Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Good afternoon, Doc. You're welcome.
Good afternoon.
It took some hustle to get here, right?
Yes, sir.
Because of time, let's go straight into the conversation. So today we're looking at asthma. So to start off, we need to understand what asthma is, and then if there are types, we want to know the types that we have.
Okay, so asthma is what we call the bronchial asthma. So it has to do with the should I say the airways entering or within the lungs.
Okay.
Yes. So usually it's a chronic condition where these airways are narrow, swollen, and there's a lot of secretions we call mucus, or sometimes you can call it
Phlegm.
phlegms.
Okay.
Yes. So it blocks the airway, and there might be episodes where they would have difficulty in breathing. Yes. So that's the asthma. And the types, there are two schools of thought. Some think it's one disease with different presentations. Some think it's different diseases which have the same symptoms.
Okay.
Yeah. So, but the commonest one we have is the allergic asthma.
Okay.
Yeah. So they have allergies. So usually they also have this allergic rhinitis or allergic conjunctivitis. That's the eyes.
Can you please break it down for us?
Conjunctivitis, your eyes.
Okay.
So you see, they are always getting this reddish itchy eyes.
Okay.
Yes. And rhinitis is they sneeze a lot.
The runny nose.
They get blocked nose very frequently.
Okay.
Yeah.
So now let's look at the symptoms. Oh, you're not done. Okay.
That's
Sorry.
the allergic. So the non-allergic asthma, they have different triggers. Some can be triggered by exercise. Some can be triggered by extreme weather. So if maybe it's very cold or it's very hot, then they have that. Some is also drug-induced, aspirin-induced asthma.
Oh, okay.
So especially those combination painkillers which have aspirin in them. Some people are allergic or they react to
the aspirin.
So once they keep taking it, quite often they'll develop the asthma. Then there's the adult onset asthma and the childhood asthma. Yeah. So the childhood one, usually, or more often than not, the childhood ones, they tend to wane in severity
as the person
as
goes.
they grow older.
Okay.
Yeah, but sometimes they persist. And then there's a variant we call cough variant. So with them, it doesn't start as the difficulty in breathing. It starts as bouts of coughing, especially at night. So they cough a lot at night. So if you don't notice it early or manage it early, then it will turn into the
full-blown asthma.
Yes.
Okay.
Yes.
Okay. So now that we understand what it is and then the types, we want to look at the symptoms and then also the causes.
Okay. So the symptoms, as I mentioned, the constriction of the airway.
Airway. Okay.
Yes. So there are three things that go on. The airway itself closes up. So the muscles contract to close up the airway. Then aside that, there's inflammation. So there's swelling.
Swelling in there.
Yes. And then there's excessive secretions, which is part of the inflammation.
Okay.
So it's like a chronic inflammation going on together with a constriction of the muscles.
So is it the secretions and then the inflammation that is what causes the
so all
airways
of those
to be
things
blocked
together are what causes the difficulty in breathing.
Okay.
Yes.
Okay.
So they would usually feel tightness in the chest. They might have shortness of breath, especially breathing out becomes a problem. They have this what we call a wheeze. So because it's narrow, the air finds it difficult to come out. So you hear this high pitched,
like a whistling sound, sort of.
Yes.
Okay.
So the louder it is, then you know that it's more severe.
It's more severe.
Yeah.
Okay. So those are basically the commonest symptoms, and then the causes. Let's look at the causes.
Okay, there are risk factors. Of course, black race is also
black race. The everything.
Not everything. The white race,
most
we don't know them. So, but the ones that are relevant to us, that's what we about.
Know. Okay.
Yes. And it's more often in females than males. If you have a family history.
Is there a reason why it's more often in females than males?
Not that I know.
Okay.
I'll have to research on that. Then people who have a lot of allergies, and then environmental factors. And as I mentioned last week, if you are in an environment where there's a lot of smoke, fumes, chemical fumes, dust, yes, those things can also cause asthma as well.
Okay.
Yeah. Aside the causes, there are triggers. So you might have bronchial asthma already, but there are things that will trigger the acute exacerbation. That's what we call the asthmatic attack.
Okay.
Yes.
Okay.
So with that, it could be smoke in the air. If someone is burning something and it enters your window or whatever. As I mentioned, exercise earlier, the occupational exposure.
How does the
as well.
exercise come in?
It's a type of asthma. I'm not really sure of the physiology behind the process behind it.
Okay.
But we know that there are some people, when they exert themselves too much, sometimes maybe we think overheating, or maybe
So it
they
makes
lose
them
a lot
difficult.
of fluid.
It makes it difficult to breathe.
Yes. So somehow that would lead to the difficult, should I say, the constriction of the airway.
Okay.
Yeah, and sometimes it's hastened. So those with asthma, they have this ongoing, should I say, inflammation already in there. So when they have something that stresses the body up,
it
then
becomes more.
It worsens it.
Okay.
Yes.
I'm asking about the exercise because I noticed that sometimes when I work out, but then when I take a long break and then I start again, like I find it difficult to breathe till probably I get used to the exercise, and then I'm okay. That's why I'm asking about the exercise, so I can understand it well.
It depends. Sometimes too, it's about the heart.
Okay.
So if the heart is not used to that amount of stress or activity, yes, then it would lead to that. But that's not necessarily asthma.
Okay.
Yeah.
Okay.
But if you're asthmatic too, you would have that same symptom.
Okay. So when you were talking, you mentioned environmental factors. So we want to look at the specific environmental factors that we need to avoid to control these triggers and all that. And then when we are done, we come back and then we look at the diagnosis, how asthma is diagnosed.
No, the environmental factors, that one, it actually depends on the person and then what triggers it. So some people, if it's pollen in the air, so if they go to a place with a lot of grass and all that,
flowers and all that,
so they would have it. So depending on the person and what triggers it. But
okay.
usually, as I mentioned, the occupational exposures, the fumes, chemical fumes and those things, they definitely cause asthma. Yes,
okay.
but the other things, dust mites. So if your house is dusty and you have these tiny insects just on top of, yes. So if you just come into an old room, you don't clean it up, then you just go and sleep in the bed, you might have
an attack.
Yes.
Okay.
Yes.
Okay.
So the diagnosis is not very straightforward, but normally we would have to take a history from the person who is having the symptoms. We have to look at the age at which the symptoms started, how often the person has been having the symptoms, if there's a family history. Then there's some aspect of physical examination that is also done to assess. We have what we call spirometry. If you see the respiratory specialist, they have that machine there. So they use it to measure your lung capacity.
Your lung capacity.
Yes.
Okay.
So they use that to determine. Also, when you want to probably narrow down the specific type of the asthma, you might do some lab tests to find out which type of white blood cell is overproduced. You might do allergy tests as well. Then we might also do chest x-ray as well. There are also these should I say questionnaires or checklists that they use to rate or rank the severity of the condition that you have. Yes.
Okay. Can asthma be cured? Again, I'm asking because my elder sister used to have asthma, but then immediately she left Ghana. For more than 10 years, she's never had an attack. But when she was in Ghana, the attacks were consistent. So can it be cured? Or it's a lifelong chronic disease that maybe sometimes it's just controlled?
So generally, it's not known to be curable. It's only controlled.
Okay.
So probably what was triggering her might have been the weather conditions in the country, or maybe the environment where she was staying. So maybe where she has moved to now, the conditions are different. So she doesn't have those triggers.
But the asthma is still there?
Most likely, yes. So once you have your asthma very well controlled over a long period of time, it doesn't easily get triggered. So if you are not controlled, then you easily get triggered. Then you are likely to have the more severe asthmatic attacks. But the emphasis now is that we have to control the asthma very well. Once it's well controlled and you don't have frequent attacks, it's like the lining of the inner lining of the airways are able to relax and rest, so they are not easily triggered to give you the attack.
Okay. So can we quickly look at the medications that are available in controlling this asthma, and then also if you can briefly take us through how exactly they work?
Okay, so we have what we call bronchodilators and then anti-inflammatory drugs. So as I mentioned, there is the constriction of the muscles. So in that case, we use the bronchodilator drugs, which will relax the muscles in the airway. Then the other thing is the anti-inflammatory. Usually it's the steroid medications. So they will bring down the inflammation, reduce the swelling, reduce the secretions within the airway. So when you have things like those two drugs, you're supposed to take those two drugs together. You don't take one and leave the other. No, you don't. So at first in Ghana, we only used to be giving them the Ventolin inhaler.
I was about to ask, where does the inhaler fall?
That is a bronchodilator.
Okay.
Yes, but in 2019, after they did some studies, they realized that people who were only on the bronchodilator usually progress to a more severe asthma. And that's where most of the asthmatic deaths were coming from. So in 2019, the international body developed a new protocol of treatment that every patient who has asthma, now we treat you with both the bronchodilator and the anti-inflammatory. So if you are taking only Ventolin inhaler, it's not enough. And there are lots of people who come and say the inhaler is no longer working for me. Yes, so the Ventolin inhaler alone is not enough. You need to add the anti-inflammatory, which is, so we have this new combination, it's inhalation inhalers. Yeah, so Ventolin was an aerosol. You shake it and then you spray it. Yeah. So now what we have are the powdered ones. In some nice containers. So those ones, you just, like, depend on the dosage, you just turn the thing and then to release the specific amount. So that
into the atmosphere.
No, it releases into it, and then you put it in your mouth, and then you suck it in. You take in a deep breath, and then you take it in. So with those ones, it's a combination of both the anti-inflammatory and the bronchodilator. And in this case, the new ones that have come out, the bronchodilators are long-acting. The Ventolin was usually a short-acting. Within 30 minutes, then its effect goes off. But these ones are long-acting. So they're actually much better. It's just that they are a bit more expensive. But that's the ultimate, and that's the best. And if you are able to be well controlled, you might not even need to be taking it consistently so much. You just take it as and when.
Finally, in 1 minute, can you take us through what you should do if you're having a severe asthmatic attack, and then at what point do we need to rush the person to the hospital?
Yes, very important, because most of the asthma deaths, they actually die before they even reach the hospital. Yes, so you have to take this very seriously. If you are asthmatic and you're having an attack, you have to take your dose of your inhaler. Always have your inhaler with you in your pocket, in your bag, wherever you go. You don't know where you will meet a trigger. Yes. So once you get there and you have an attack, you take one dose. Usually the dose takes about 15-20 minutes to be fully effective. So if you take it 20 minutes, you are still having a difficulty,
then you take another one.
So you repeat it. If on the fourth time you are repeating it, you are still not feeling better, rush to the hospital. Don't say you wait or you try more or it's too late in the night. Come to the hospital immediately. Other signs that you might see bluish coloration of the fingertips and the lips becoming bluish.
That's the person is on the way to death.
Yes. They would be coughing so much they can't stop coughing. Sometimes the breathing is so difficult they are not even able to make a full sentence. You see them sweating severely, sweating a lot, very pale. That means they are on their way out. So when you see those signs or you see them breathing very, very fast, yes, then you should know that they should be rushed to the hospital immediately.
Okay. Thank you so much. I think that's a very important thing. So if you're asthmatic, always have your inhaler
Always
with
have
you.
your
I know the
inhaler.
ladies, we are culpable because we say, oh, this bag and the dress, the inhaler won't fit because I need to fit in other stuff. But please, your health is more important. So
Yes.
find a way and fit that inhaler in your bag. So, Doc, thank you so much this afternoon for having this discussion with us. Definitely we'll see you next week, Tuesday,
Sure.
for another talk.
Thank you.
Thank you. And that was Hello Doc with Dr. Emefa Dzide. In no time, Michael